welcome to Real Talk with Cece. In light of Mental Health Awareness Week, we are going to be covering our part 4 of our 5 mini-series covering anxiety. This one will be covering obsessive compulsive disorder, or OCD, if you want to remember it that way. Now, OCD is one of the most misunderstood disorders there is out there among society, and what I'm here to do today is to help kind of set the record straight and to give a little bit of insight as to what it really is, what it's like to live with it, and just what to recognize in those that you love, so that way you can help them identify the problem and help them get the proper treatment that they need to cope from it. Now, there's so many misconceptions behind OCD that I'm not quite exactly sure where to begin, but I will begin by saying that according to research that I found, it is said that OCD is characterized by unreasonable thoughts and fears or obsessions, which will cause compulsive behaviors. Now, this will affect someone with OCD in more ways than just one. It will affect them with their mood, psychologically. It will affect them mentally and emotionally, as also in other common ways you will see them having aversions to certain food or avoiding certain things that might require touching common objects that other people have touched, like doorknobs, flush handles on toilets, things of common nature, but it's more than just that. And to help illustrate that, I've got a bunch of research in front of me here that I'm going to try and help illustrate as best as I can for you guys without looking down so much. I know you guys want to see this mug, so I'm going to try and help you guys stay focused. So, anyways, when it comes to OCD, the main aspect that it is centered around in most people is fear. Now, when there are themes of fear, it will cause different symptoms and reactions of the person with OCD to have display or experience for themselves internally. So, for instance, if one has a fear of chaos, they will do everything they can to keep their house and their space in order. They'll have a severe agitation if anything is out of place in particularly, or if there is a way that they need to rearrange things. It'll be to a point sometimes where a person can't even leave their house until they have everything in a precise order and manner in which they find suitable for them. And that can be a little limiting for someone with OCD who has to have an income and has to pay for their family and take care of themselves, and it gets a little stressful for them. And so there's also, for another instance, if someone has a fear of germs or dirt, you'll find that someone will have an excessive cleanliness. They will shower, wash their hands regularly. They'll avoid shaking hands or hugging anybody, which could eventually lead to social isolation. And another instance that someone with OCD might experience a fear theme or some symptoms is when they have a fear of making a mistake. And so something that will be of that nature, you'll see them constantly needing reassurance and encouragement to validate that what they're doing is correct and okay. It seems as if a lot of the themes behind OCD, according to my research, is that it is characterized a lot of around fear of acceptance and being embarrassed, fear of violent thoughts towards yourself or towards someone else. There is a lot of different aspects behind it that almost makes me seem as if it was to be for someone that was a perfectionist at heart, someone that just wants to get everything done correctly and right and not make themselves do anything awkward in social situations. And so I can understand exactly how that can be a very limiting and borderline crippling feeling because of how well you want to do at everything. For someone with depression and anxiety and insomnia and PTSD, I do understand that there is a lot of emotions and complexities behind the brain and what it's exposed to and how your body and your mind can react and cope with it. And so in light of that, it's always important for you to be having open communication with your doctor and with your therapist, with all of the people that you've got that are regarding for your mind and your health, because your mind is just as important part of the organ as any other part of your body. You need it for your functioning, you need it to have your heart beating, you need it for your lungs. There's a lot of different things behind it, and just to keep yourself mentally stable so we can deal with this thing they call life. And you want to just try to find the right coping mechanisms that are healthy, proactive, and will be most beneficial for you. And so from here, I'm going to suggest that you look into cognitive behavioral therapy, or CBT. I have seen that a few times being a very efficient technique of therapy for people with multiple forms of anxiety, and along with psychotherapy too. And so another misconception that I wanted to clear and set the record straight is that there is a misunderstanding that this is just a genetic thing. While there is studies that show that if you have a parent that has either that of depression or anxiety, you are more likely to develop OCD, there is also the factor that it actually can be triggered by a series of stress and pressure. So this is something that can happen with a lot of pressure and no proper way of dealing with it. And this can take either years to cope from, or it can be a lifetime. If it's something inherited genetically, it's most likely a lifetime. But there are ways that you can work with it, and there are ways that you can get control back of your mind, and you can get control back of your life. You don't have to leave it up to your mind and your fears. You know, Teddy Roosevelt said that the only thing that we have to fear is fear itself, because when we're putting ourselves in a mentality of fear and it's stimulating the amygdala that controls fear response, we are putting ourselves in a state of hypervigilance that is used for combative reasons, either to make sure that you are in a safer zone, or if you have any immediate dangers or threats around you. And when you're discussing hyperactivity of fears, it's important to understand that that is inside yourself. And the sooner that you can accept that those fears are what you are thinking of, those are what you are fearing, you're thinking your feelings. And one way to feel the feelings is to be emotional and expressive about it, but you don't need to think your feelings. You have to separate the rationality and understand the difference between what's a healthy thing to be concerned about and worried about, and what is in your mentality spiraling negative downward into a state of obsession or fear. It's a very delicate balance that one must learn to master. It's not an easy thing, but it is something that can be done once you dedicate yourself to that cause. Now, for anyone that doesn't have OCD that's watching this, I hope you're getting a lot of good information about this and some clarity about exactly what OCD is, what it's like to live with it, and how you can help your family and your loved ones going through this in an easier light. You guys are just as important as the people that are going through it, and the sooner we can get all this information out and people to actually start doing research on these things for themselves, the sooner we can get an actual proper consensus on how to treat it and how to take care of it. And so that is all I have for you today on Real Talk with Cece. Please stay tuned for our next week's segment covering PTSD, post-traumatic stress disorder, and we will see you we'll see you until then, but I hope you guys have a wonderful week and that you guys are taking care of yourselves.